is my privilege and honor to
Once again,
that's right, to introduce this year's Education Grand Round speaker, Dr. Larry Greenberg. Dr. Greenberg comes to us from George Washington University most recently and currently, where they were fortunate enough to hold on to him as a senior consultant for medical education and professor emeritus. So Dr. Greenberg completed his undergraduate degree at the University of Toledo and his medical degree at the Ohio State University School of Medicine. He completed his internship at Buffalo Children's, his pediatric residency and chief residency at Columbus Children's Hospital. He then served for 2 years in the United States Army at Fort Meade before rolling into his various roles in medical education. Those various roles in medical education spanned multiple institutions, including Johns Hopkins, Holy Cross Hospital in Maryland, Children's Hospital National, and George Washington University. Within these institutions, he climbed the professorial ranks, and he served in various medical education leadership roles, starting and directing multiple programs. Dr. Greenberg has close to 150 publications, nearly 100 abstracts, and he's written numerous book chapters and won a ton of education teaching awards. Incredibly, Dr. Greenberg has also made close to 350 invited presentations across the country, which includes around 2/3 of the medical schools in the country, which I think is pretty impressive. I believe you'll find Dr. Greenberg equally impressive in person to his CV as he engages you with a discussion on how do I know I am teaching effectively. So please join me in welcoming Dr. Larry Greenberg.
well, thank you very much for the invite, especially because it's Education Day, and I know it's only one day a year that we focus on education, but you know, it is part of the mission statement, and it's part of what a medical school is all about, and our residency programs, and we should highlight this 8 or 10 times a year, but it is what it is, and I'm
We
glad
do.
everybody-
We've
Sorry?
got lots of opportunities. We focus on education multiple times.
Yes. Thank you, Sherry.
All right.
And I want to specifically thank Sherry. I don't know how she found me. We go back a few years when she was at Duke, but I got, I think, an email from Sherry and Ryan somewhere around February asking me if I would come, and I asked, sure, I'd be happy to, and what are the topics, and we'll get back to our faculty and see what our faculty wants, and so we're giving you what you want. If you don't like this, I'm going to do the best I can. But I want to thank Sherry, Mariah, Deb, Sandra. They're the behind-scenes people that nobody ever thinks about because, your lunch is here and the thing is set up, and they're the unheralded people that don't get the kudos that need. The need to get the kudos for the work they do, so I'm shouting out for them. So for this session, anytime I go places as a visiting professor, I always have to do a grand round or some sort of plenary session, which, by the way, is my least favorite thing to do because it doesn't allow me to engage quite as much with you in a work as would be in a workshop. But I hope this will be a fun session for you because what it's going to focus on is really two issues. One is a whole issue of teaching and learning. This is not a Greenbergism, PowerPoint slides. It's taken from the literature, so what I'm going to be talking to you about is really evidence-based. And then the second issue is how I do the presentation. So I'm going to try and point out, and I probably don't have to for this crowd, based on what I've already known for the last almost 24 hours, is how much you're into education and how savvy you are about things. But I'm going to try and show you the importance of making a lecture like this interactive, as interactive as you can be, and it's part of a large group setting. So the content is going to be what my life's work has been all about. So I had an epiphany in the early 70s when I was a very junior person, managing a group of residents rotating from Children's Hospital to a very nice community hospital in Maryland. And I had an epiphany that, I wasn't sure I was really the greatest teacher as everybody thought I was, and I ended up going to a workshop in Chicago, Illinois. South side of Chicago. It was like a 3-day workshop, and I walked out of there and I said, ooh, I'm not a great teacher, I'm a great information giver. I got to change that. So serendipitously, in those days, there weren't a lot of opportunities in terms of how to get yourself educated in medical education, but I will say I'm probably one of the few people that ever sat with the father of medical education, George Miller, at the University of Illinois. When I went there for a 2-week they accepted me for a 2-week kind of intensive training, and I sat with him, and he listened to where I was going and what I was all about, and I would just tell you that one of the things he brought out was, so what's happening to people around you? And I said, well, that's a good question, but not much. And he said he got up and went to one of his bookshelves and pulled out a book on change. He says, this is what it's all about. It's not just about you and your willingness and commitment to education. It's about how you bring people with you. So you as faculty have that responsibility. That when you do something other than what residents and students may be used to, maybe as a substitute for a lecture, they understand that there's evidence that, what you're showing them as another way to present information in terms of activating learners. So it's a big responsibility we have as faculty in terms of modeling those things. So I need to ask, how many of you came for the food? Nobody? Oh my God, I'm flattered. Okay. How many of you knew the title before you came? Wow. Okay. So the title is, How Do I Know I'm Teaching Effectively? You got a minute. You got a minute to turn to somebody next to you and answer the question. Go. Even with your mouth full.
Like that? And I love the addition.
In a lot of ways, art is what the students' feedback from artists. I think how they do it is important, but I also think what they generally is when I used to sort of
Other 50 seconds?
I used to I generally say radiology area, maintain contact with and but that wasn't really much.
Okay, can we bring it back together again for a little bit? Well, what impresses me about, throwing out questions like this in a kind of a lecture format is how activated learners become and the cacophony that occurs. So I challenge any one of you who does a straightforward lecture. There are places where straightforward lectures have to be done because of the content. It doesn't make it very easy to do interactively, like talking about oncogenes or something else way over my head. But this cacophony is so important because it means that learning is going on. A former head of the organizational management school at GW, who's very well known, unfortunately died a couple years ago, has a wonderful article called Learning to Not Teach. It's in Change magazine, which I don't generally read, but this is you can get it on Google. It's a 3-page article. But he talked about when he went into a classroom and he saw people talking, students talking, he knew learning was going on. When he was doing your talking, this is my challenge to you, how do you know learning is going on? People say, well, people are looking at me. I said, yeah, but what are they learning? What is going on? Are they really learning what you want them to learn? So it doesn't mean we should do away with lectures. It just means we should think about how to make lectures more interactive, and hopefully we'll do that today. So answering the question, how do I know I'm teaching effectively? What'd you come up with? Exactly what your trainees do when you hesitate. Please. Assessment. What do you mean?
So, exam scores, formative assessment, periodic assessment, and
Good.
summative assessment.
Good. Okay, so assessment, that's important in terms of, did the trainees really get the information? What else? Good start.
Just to let you know, Deb is going to be wandering around, so if you have a question, she's going to stick a
Yeah, I want to
microphone
make
in
sure
your
we
face.
pick up your comments,
Yeah.
so I know this is being streamed, so we want to make sure people on the outside.
May I ask you back questions about the topic we are discussing?
They ask questions about the topic. So you pique their curiosity, and they're starting to ask questions because they don't maybe have it all, or they're asking you a question just to reconfirm what they already know. Sometimes that happens. You say the answer, and sometimes it's exactly what they're thinking of. So what else?
They're engaged and actively participating. They're engaged and actively participating.
Okay, so engaged and actively participating, absolutely. I mean, if the cell phone's on and out, and, you notice, I'm not behind that thing. I mean, a good lecture that does it interactively is out with the group. It's a way to connect with people. You look at people's faces, you look at their eye contact. It's not standing behind something between you and the audience. I don't go for that. It's just not making a connection. Sometimes it's up on a high stage and then, So I walk the room and that's the way I try to connect with people. So, yeah, what else? Engaged. You can tell when people are engaged.
I see a follow through. They'll finally make a decision and usually incorporate some elements of what you recommended or teach, and that they generally start to make a decision.
Okay, so that's a good point. So if you read the literature about, what changes patients' behaviors, it's usually a lecture, on high blood pressure medicine and adherence to medical advice, and so that doesn't do it. It's a follow-up in terms of what happens during that session that down the road, we don't do this very often, follow up our lectures with, so what happened to you? Have you changed your behavior? And really, I would like to know after my visit here if anybody's changed their behavior based on stuff that we've talked about. It's not that your behavior isn't good, it's just going, the next step and maybe learning something new. Whenever I go to a place and learn something new and incorporate that, I mean, kudos to that person that led that session. What else?
When they apply their knowledge that they gain, when they apply the knowledge they gain to patient care or to their documentation or whatever it is that you guys discussed.
So again, going the next step, going from knowledge to application to patient care, so that makes it all worthwhile, right? So I told you about the objectives, so we're really going to be looking at how to, model an interactive session, and we're going to look at answers to this question about how do I know I'm teaching effectively. So here's a couple things I wrote down. I'm not saying these are all inclusive. You listed a number of them, and you probably have more. I don't know if any of you have seen Atul Gawande's article in the New Yorker in 2011. Fabulous article. This guy he is such a wonderful speaker. He's a surgeon. I think he's at Stanford now, or Harvard. I can't remember which. Harvard now? No. And midway through his career, he thought, shouldn't I have someone coach me and look over my shoulder and see what I'm doing well when I'm not? So he called his former chair. And this article is by his former chair who was retired, came and observed him for a couple of weeks, doing what he does every day. He gave him feedback. Oh, wow. A wonderful kind of opportunity. We could do that too in our, somebody could sit in our sessions, give us feedback as a coach. We don't do that often, but it would be something to do. Reflective practice. Well, I don't know how many of you use the shown, the reflective practitioner model, and how am I doing prospectively? How did I do after it's over? How would I change things next time to make it even better? That's reflective practice. To me, that's built in. I'm hard on myself, and after this session, I'll go home and I'll say, I should have done something differently, I should have added, whatever. Feedback, learner outcomes, talked about that. Questions, you talked about that. Learners teach what we have taught. So they take what we have taught and they transcribe it into a teaching session for either peers or somebody else. I like this connectedness, and I think faculty need to think about that, you know. There are boundaries, but there certainly is a way to connect with students and residents to make them feel that it's safe, that we're here to make them the best they can be, and that we're not a barrier, but we're someone to help them through their experiences. Portfolios that document, I don't know how many of you use educator portfolios, but they're so important to document what you do. Not just, oh, I gave a lecture to a group of third-year students, but I gave a lecture and this is how it impacted them on them based on their feedback. And that's part of promotion for people who really spend a lot of time teaching. And then self-assessment is another one. So why interactive lectures? Well, I don't have to go through this line by line. I can just tell you what's the attention span for anybody in a lecture?
10 minutes.
15 minutes. That's based on literature. So it means if you're doing traditional lectures, damn, you got to do something in 15 minutes and 30 minutes and 45 minutes. You've lost the group. That's the way it goes. I don't care how big you are. You've got to do something to change up. To give, you know, it could be turn to someone and talk about a specific point you just made. It could be, you're going to see, I use movies because they're engaging and they're content neutral and people relate to them. But there are a lot, you can use cases, you can use all kinds of different things. But you got to get, I say attention span 20 minutes, but it's really 15 to 20 minutes at most. So we got to use some sort of change up in order to get them thinking about staying connected. And then I gave you Harvey's comment, when the teacher's doing all the talking, how does one assess learning? Impossible. I don't know how you do that. The learners are spectators, they're not players, they're not engaged. My whole mantra with learners is make them activated. Get them activated. There's literature up the gazoo in terms of activating learners and what that means in terms of retention in both breadth and depth versus being passive. So we got to figure out a way to activate learners a little bit better. Institute of Medicine, which really Congress takes its lead from, started back in 2009. I just mentioned earlier, traditional lecturing does not change physician behavior. It's upsetting to hear that, but it's the truth. And we got to figure out ways to do it better. And then again, establishing a more learner-centered climate. It's not about us, it's about our learners, and we do that by engaging learners, activating learners, and getting learners involved in terms of what we're doing. I love Ruskin. I don't know where I found this, I love quotes, but Ruskin said, John Ruskin, who was an artist, poet, author, Renaissance person, 19th century, education doesn't mean teaching people what they do not know, it means teaching them to behave as they do not behave. It's not teaching the youth the shapes of letters and the tricks of numbers and leaving them to turn their arithmetic to roguery and their literature to lust. It means, listen carefully, on the contrary, training them into perfect exercise and kingly continence of their bodies and souls. It's painful. Yeah, sometimes we wake up and we say, I'm teaching today, and it can be painful. It's continual, difficult work to be done by kindness. This is the humanism of what we do in our work. By watching, we don't do enough of that. We need to be observing people firsthand to see how they actually perform. By waiting, and not being out there and telling them what we think, but letting them tell us what they think. By precept and by praise, and above all by modeling, by example. He wasn't a doctor, but he got it right. So here's the modeling. So to answer the question, how do I know I'm teaching effectively, is based on this model. This is not my model, it's what I took from the literature when I tried to answer the question myself. It's all about the teacher, the learner, the learning climate, and the curriculum. If any one of those is missing, you will not be a good teacher. I can guarantee you that. And I can watch them and I can tell you where the gaps are, and you can do the same with me. Those four issues are absolutely critical in terms of answering the question, how do I know I'm teaching effectively? So as we go through these things, I want you to kind of reflect on, as we go through each area, what are the factors that make up each component regarding your teaching? How would you score yourself? And think, if you were in someone else's shoes, especially the learner, how would you feel about some of these issues? Okay, quotes again. How trainees learn is as important as what they learn, and understanding how they learn can contribute much to what they learn. That is a very important statement. It's not just about knowledge and facts, but it's about the process of learning and taking into account evidence, adult learning principles, and other issues. I love this from Larry King. I never learned a thing while I was talking. He was a good, I didn't always like him, but he was a good facilitator in terms of engaging people in a conversation. And if you noticed, his talking time and the person he was interviewing talking time, it was probably 20%, 25%, and the person he was interviewing 75%. Well, you know that? It should be that way with patients. Our patients should be doing most of the talking, and it should be that way with our teachers, where the learner is doing most of the talking so we can make sure we know where they are, diagnose them, and help them get through an issue. One of the single most important facts about learning is to determine what the learner already knows. That's an adult learning principle. Schulman said that, former president of Carnegie Foundation. We need to start there before we make any assumptions that we know what learners need to know. So I start with adult learning principles because that's really the theoretical construct under all teaching and learning. So I'll ask the question, don't be embarrassed, because I've been in many medical centers, ask the same question. How many of you have had any kind of contact with, read about adult learning principles? More than any place I've been. Go Hokies. I like this because it's hard for me to believe. It's really hard for me to believe. Okay, I graduated med school, like most of you did. I went through my residency. Now I'm a teacher. Hello? Where are my credentials? My wife went through 4 years of education to become a teacher. And I went through no years of formal training to become a teacher when I finished my training. Doesn't make sense. So, we got to start with adult learning principles, because if we know what's out there, then we can more adjust to our learners and more adjust how we teach. So everybody needs to, and I'll tell you 2 articles. If you look up in British Medical Journal, an article by Kaufman, D.M. Kaufman, and Peel, I think of it, P-E-I-L-E. 6 pages on adult learning that'll tell you all you need to know. I won't tell you what Sherry knows, but it'll tell you what you need to know.
But it is posted on our website, that very article, so.
All right. So again, foundation, as soon as the learner has a major responsibility for mastery and self-assessment. And again, I always look at, when I teach a learner, my ultimate goal is to make them self-directed. You don't make someone self-directed by talking to them. You make them self-directed by activating them and facilitating learning. So when they don't have it quite the way you want it, then you interject what you need to interject and stimulate them even more. Because when they get out and they're not around you, this is continual professional development. It's what our careers are all about, no matter what we're in. Medicine, health sciences, dentistry, whatever we're in, it's all about continuing professional development. You need to train them to do that. They need to be reading and taking responsibility for their education, not dependent on us. We're a small part of their careers. So they bring experience to the plate. So I did a session a couple weeks ago, or maybe it was this morning. It just seemed like a couple of weeks ago.
It does.
A session this morning on the 8-step preceptor. And one of the first things you want to ask your learners in a clinical situation, have you ever seen a patient like that before? And then you can determine what you need to teach that person. If the person says, I've never seen a patient like that before, you can teach almost anything. If the person says, oh, I've seen a lot of patients like that before, then you have to negotiate what you're teaching to be. No assumptions. No assumptions. We can't look at learners as, nothing up here, and we'll tell them, like, we'll fill the brains, we know what they need to know. No, they bring interesting experiences that we never even ask them about. And we need to know this, because those life experiences are part of where they are today, and what they bring to the plate, and how motivated they are, and so forth. Problem-oriented, well, we know that. But we teach them the problem-oriented way. So you think about a problem, it may be bleeding, or maybe shortness of breath, whatever it is, that's the way we teach. And that's what Knowles talked about in adult learning principles, that adult learners in the workforce think through learning around problems. That's how learning occurs. around specific problems. So we know that our students come with varied learning styles. I don't change my teaching based on that. I try and engage them based on how they learn best. But I'm a facilitative teacher. I'm not an information giver based on my change in my career that happened 40 years ago. So some students and some residents won't like me because they just say, just tell me what I need to know. And I can't tell them what they need to know. It's impossible. It's all based on individual issues and what they bring to the plate and so forth. So we try and accommodate those learning styles. So I gave an example whenever it was, maybe this morning, where someone said, tell me about the circle of willows. And the trainee responded, I can't tell you about the circle of willows, but I can draw it for you. Okay, so there's a different learning style. And I can accommodate that if that's the way that learner is. It doesn't mean I'm going to totally change my teaching, but at least I appreciate that learner being a little different than some of the others in the group. And then, of course, modeling of behavior. You know, what we say and what we do are important. It's not just saying it, it's walking the walk. So, you know, that's got to go hand in hand. Okay, so we know that, based on Knowles' work, that learners are basically self-directed. So if we give them a leash and let them run, they'll run with it. So they get through stuff with or without us. So sometimes they have bad teaching, not here, but other places, you know, where they're undergrad or whatever. I'm not talking about here. I didn't get any complaints from the students and residents, none. I'm serious. But, you know, they're going to get, as long as the bar is clear, they'll get there. They'll get there. Self-directed. Intrinsically motivated. So somebody came up to me earlier and said, you know, I see some people that just aren't that interested. And I'm saying to myself, yeah, but these people are intrinsically motivated. What's going on? Are the goals and objectives not clear? Are the roles, responsibilities, and expectations not clear? Because some trainees deviate when that happens, when it's not clear where they're supposed to go and how they're supposed to get there. Others will look at that and say, I'll get there no matter what, as long as it's clear where I'm supposed to go. And they'll go there and beyond. Link their learning to self-concept. So some people, self-concept-wise, early on in their training, you know, are not real confident and not really willing to take chances and go forward. And that changes with time. That's a developmental issue. The important thing is ability to, or opportunities to apply what they've learned. So these sim labs have been a blessing. You can take a sim lab and they can do procedures, they can talk to standardized patients, and it is like as real as you can get it. It's like the real McCoy. It's a simulation, and everybody knows it's a simulation, but it's next to the next best thing. It doesn't replace observing them with real patients, but it's the next best thing. And then the contextual piece of learning. So, you know, I'm on the downside of my career. I'm a PGY 52. I can just tell you, when I was actively in practice, I was a clinician educator. I spent about 40% of my time in practice. I ran the Office of Medical Education. I was the DIO. I ran faculty development. I ran continuing medical education, blah, 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 blah. But when I was engaging trainees, there were responsibilities that they had. When they saw a patient, they read on the patient. No choice. There's no choice there. Why? I said earlier, I don't exactly know the neurology of that, but there's something about neurons and synapses. When you see a patient and read about it, it sticks. When it's not patient-related and you read about it, 20% sticks after 2 weeks. In my case, 12%. It's age. Whatever. So, point being, don't lose opportunities. When residents tell me I don't have time to read, my retort is, no, you don't have a lot of time to read. You have time to read. And I'm not expecting you to read reams and reams. Just read about your patients and figure out how your reading fits in with what you're seeing. And then I love Covey's thing with his first book, 7 Habits. This is a pediatric thing. It's developed now because we see learners going from dependent, that's the infant, to independent, that's the toddler and adolescent, and then independent, the way the real world works. And the reason I show that is because getting to the independent, to the interdependent stage is critical. Nobody does this alone in medicine. You may be in solo practice, you're not doing this alone. You've got an office of people, you've got people you work with in terms of referrals, you've got school systems, you've got whatever. You're not working alone. You're working in groups. Learn how to work in groups. This is a big shift for students. They're used to working alone before they get to med school. And then they find that that's not the way medicine is. It doesn't work that way. And some of the other areas involved with medicine. So here's the Karate Kid. I show you this first film. I want you to think about what we just talked about learning-wise and see what happens in this little clip. Looking at the relationship between the teacher and the learner, looking at the teacher's style of teaching to what you might have done, made it something different, and what made the encounter effective. So let's see if I can do this. No, I shouldn't have done that. Let's see. Yeah, here we go.
Did you fix my bike?
Hey,
Thank you.
welcome.
Yeah, I really appreciate that. Are those real trees?
Would you like to see? Come inside.
Thanks. How do they get so small?
I train. Click here, tie there.
Where'd you learn how, Japan?
Okinawa,
Where's that?
my country. China here, Japan here, Okinawa here.
You go to school for this?
Father teach.
Was you a gardener?
Fisherman.
Oh, what happened? No, I may not be able to get that back. So rather than trying to fool around with the AV stuff, let's turn back on the lights. There's another maybe minute or so of that. I can just tell you what happened. Mr. Miyagi, Ralph is showing interest in this tree. And if you do the story, he was a kid, single mom, kids were beating up on him, smashed his bike, Mr. Miyagi fixed his bike, and they developed this friendship. And so he's in there watching Mr. Miyagi, and he's showing some interest in these trees. You just saw that. And Mr. Miyagi says, "Come, you try." And Ralph says, "No, I can't do this. I've never done this before." He says, "Come, you sit here." And there's a tree in front of him, hopefully not an expensive one. And I don't know that from the movie. But he sits him down, and he says, "Close eyes." And Ralph closes his eyes. He says, "Think about the tree, only the tree. Make a," I know this movie better, "make a perfect picture like the tree." So Ralph does that, and he looks up, he opens, and Mr. Miyagi says, "You ready?" And Ralph opens his eyes, he says, "I'm ready." He says, "But how will I know it'll be the right one?" And Mr. Miyagi says, "If it comes from inside of you, it's the right one." And then music plays. I can't, you can't. Okay, so in terms of the relationship here, in terms of the teaching style here, talk to me.
Reflective.
Who said that? Reflective, so meaning,
Asking him to think about what's inside of himself, not external.
okay, there's no right or wrong way there, right? Yeah, so that's fairly safe for a kid who doesn't have much confidence and isn't, I mean, if he sat me in front of the tree and had the same question, first I'd ask, how much did it cost? And then I'd say, okay, if it didn't cost much, I'm willing to try it. Okay, so that's good. Another one?
The young boy expressed interest before he comes.
So you think about this with our students or residents. When you pique their interest in something and they start to kind of nibble away, and you know, when you see that, follow through with that. They're obviously doing that because something you've done has turned them on, and it has piqued their interest, and they want more. So I know time is valuable and hard to kind of buy, but at some point or another, you can pick up on that critical incident and move that forward and make that trainee feel, a little different. What else? Please.
Mr. Miyagi committed to the learner first. He fixed the bike, so he engaged him initially and showed commitment.
Okay, so good. So basically what was said is that he had this previous experience fixing the bike. So they established a relationship. Picture this with your trainees. Okay, one of my good friends who unfortunately died prematurely in an airplane crash, when he did the newborn nursery, he would go around the room, everybody would introduce themselves, and talk about what they would be doing if they were in medical school, if they weren't in medical school. Sous chef, all kinds of things came out. What did this do? What does this do when you engage people like that? It personalizes it, humanizes it. It says, I'm not just a physician, I'm a human being, and my friend used to say, this is what I would be doing, the same thing. So I think that's important here. Then, they segues into the tree, and how would you teach differently here, if at all? He just said, sit down, trim. Surgeons don't do it that way. Surgeons say, you look textbook, you read about the layers of the abdomen you're going through before you hit the appendix. You notice when you get in there. When you get in there, I'm going to ask you what layers you're going through. And, then we'll see how this goes. So there's preparation there. Well, what else? What's another way of doing it? So you can read a book on trimming a bonsai. What else? You do this all the time in your practices?
Yeah, watch you.
Model it. Watch what I do. Okay? And that's, again, I said it earlier in this session, that's called activated demonstration. You do it unconsciously, competently, but that's not what our learners are all about. So as you go through it, you have to break it down step by step so the learner knows exactly what you're doing and how you're doing it versus just trimming it. The learner says, okay, I'll see if I can duplicate that. The learner can never duplicate that way. Not unless you walked him through that, so he would know exactly what you were doing and how you were doing it. That's called activated demonstration, where the learner's not just following you passively, but you've got their, antenna up a little bit, so that they're really there as a participant, not just as a bump on a log. Please.
Well, I saw Mr. Miyagi as not sure and setting the young man up to determine whether he was even interested in learning. So he made minimal answers to his questions to see whether he was going to ask the next question and then the next question. So it was building Ralph or Daniel, whatever his name was, into an active learner and verifying that he wanted to learn.
Great observation. I've learned something new every time I see these movies, and I don't know if that was cultural, whether that was a cultural issue in terms of how he responded, or whether that was planned. Doesn't matter. But, it continued. It wasn't like there was a stopping point. But he got to the point where he said, now you're going to try it. And Ralph didn't say I'm going to try it, but he showed enough interest. He said to himself, I'm going to let him do this. There was another question over here.
I think the other thing he did, or you should do, is make it safe, or make the person know that it's safe for them to make mistakes.
Exactly.
A little bit of latitude.
Beautiful point. When you are there observing, there won't be any big mistakes made. If there is a mistake made, you can correct it immediately, so the patient isn't harmed. When you're not there, I don't know what goes on. It's hard. It's hard to know. Okay. Is this where we are? We're okay, Sandra? So next piece is a safe learning climate. To me, this is one of the most important pieces. I talked to the students and residents yesterday about the inverse relationship between a safe learning climate and incivility. I say you have a safe learning climate wherever you are, your office, your lecture room, your small group discussion places. If you have a safe learning climate, you don't have incivility. You don't have demeaning comments. You don't have stuff going on that don't belong in any environment. In fact, I told the students and residents, in some places in the world, Australia is one of them, They have zero tolerance for workplace bullying and incivility. If you are found to do any of that stuff, you're out of the job. Zero tolerance. Not in this country. As you know, on the internet and other places where kids commit suicide. Okay. John Maxwell, author and leadership expert. People don't care what you know until you know that you care. So it's a piece of the learning climate in terms of your connectedness to learners is very important. Knowles, talk to you about him. The behavior of the teacher probably influences the character of the learning climate more than any single factor. There's no question about it. And you know, some of you read Blink, Malcolm Gladwell, I love his work. If you've ever heard him speak personally, oh my God, you can come close to him. But as a speaker, but you know, you form an opinion immediately. You did with me. And if it doesn't start out right, it doesn't go very well the rest of the way. If it starts out okay, it usually finishes okay. So that's important about learning climate because it starts with second one when you engage a group of residents or students. If it starts on a negative note, if it's not feeling good and all-encompassing and safe, you've lost it. So you got one chance to do it. That's it. So what's a safe learning climate? Well, it includes some of these things. So what are the learning experiences going to be in this rotation? What are you likely to see? A learner needs to know that. It takes some of the anxiety out of the situation. I remember my first rotation in the NICU at Children's in Buffalo. No one oriented me. I was so scared, scared of killing a baby. I didn't know what I was going to be doing in there. I mean, nobody oriented me. It shouldn't be like that. We should know what the learning experiences will be, what our support systems are, who is available, to help us. We're not in this by ourselves. This one, to me, is one where we fell down. And that is be clear about roles, responsibilities, and expectations. So when I see or someone tells me about a resident that doesn't seem interested or a student that doesn't seem engaged, I will tell you that either those weren't clear or there's something significant going on with that person. Medically, interpersonally, substance abuse-wise, health-wise, something going on with that person. So let's be clear about those. So we know what they can expect from me and what I can expect from them. That happens during an orientation. First day that they're with us, whether you're in an office setting, no matter where you are, it needs to be clear. And to me, I like to highlight the major issues and give them a hand up and say, there are other things I didn't have a chance to discuss. Look at those and let's talk about it if you have any questions. It's this, not this. So I say, this is what I can offer you. What do you think? And if I get some buy-in, I usually 99.9% of the time I do. If I don't, then we talk about it. Same way with them. I mean, if they don't like the fact that I'm telling them they have to read on every patient, then we're going to talk about that. I'm going to tell them why, which I usually do to make it seem reasonable in terms of why I want that. The balance between challenging and safe, I don't have to define that very well, but the first day of a rotation for a student or resident might just be a day where they follow you around, just to get a feel for what is this like in this office or this setting or whatever. And the next day they're on their own. They get a day to do it, then they're on their own. And you can walk them through, what you're doing during the day and help them, again, feel this safe learning climate. The physical climate, well, I'm not going to get much into that. I love this physical climate. This is not a lecture hall. This is a hall where you can turn around. You can't turn around in a lecture hall. You can talk to people behind you, which you will do after the session. We'll talk about some issues around some of the things I'm addressing. Temperature in the room. If it's really hot, no one's going to stay. So the physical aspects are important, but the most important, as Noel said, was my relationship to the learners. I love this admits limitations. That's one of my favorites. I like to talk about that to show them I'm human too. I'm not up here. It's more here. We're closer together. The difference between me and my learners is that I'm a senior learner and they're junior learners. We're all learners. And by the way, we're all teachers, right? Tell me a first-year student can't teach me something? Guaranteed they can. My basic science was 1961. I think things have happened since then. When Mendel was screwing around with peas and stuff. Yeah. So everybody's a teacher, everybody's a learner. And that needs to be clear, you know, and admitting limitations is perfectly fine. So sometimes I will use I questions and I will say, I can remember when I was a student, you know, how when I started to learn the Krebs cycle, I had no idea what the clinical implications were, and all I knew was I had to memorize succinyl-CoA and all the rest of that crap, and after the test I said, that's done. Until I had my first diabetic patient. Then things changed a little bit. Yeah. Safe learning climate, you know, a tone or atmosphere, you can walk in a room and feel it. You can feel it. You can see what the students are doing, the residents are doing, the teachers are doing. You can feel whether it feels safe or doesn't feel safe. You know, we absolutely suppress our trainees. You know why I say that? I see them out in front of the medical school, jovial, interacting with one another, and then I look at what they're like in the classroom and I'm thinking, oh, yeah, what are we doing to these people? Learners' names are important. That's not always easy when you have a big lecture hall. I know you only have 42 students per class, but trying to learn as many names as you can is really helpful. In a clinical setting, when you're one-on-one or you just have a couple of people with you, that's important. That's part of the learning plan. The educational contracts need, that's Knowles' stuff. So some people, and I've done this many times, is I'll hand them a piece of paper beginning the rotation, I'll say, what do you really want to get out of this rotation? Write down 3 or 4 objectives that you feel would be important for you to learn. There'll be other things, but these things you absolutely want to get to. And then midway through the rotation, I'll say, here's your objectives back. How are you doing? And have a conversation about that. Now, I've seen this, but I really haven't gotten to this. Okay, we've got 2 more weeks. Let's see if we can get to this. So that's kind of a learner-initiated thing, where they write down their major issues. So if a student knows she's going into orthopedic surgery and is not crazy about the newborn nursery, you know, babies have strange things with their extremities. Their feet turn in, you know, from position in utero, and they have, you know, we need to make sure they don't have hip flex for congenital developmental dislocated hip and so forth. So, you know, an orthopedic, future orthopedic surgeon can concentrate on other things too, but we can guide them that way. Kindness, collegiality, again, countering instability. Teamwork is an important issue in terms of learning climate. And I love this thing about connectedness. And you know when you're connected to a student, you know, and you know when you're not. And the students and residents definitely know. Okay, Indecent Proposal, another movie. I want you to look at what this guy's doing first day of class, architecture class, how he's handling it. And if you'd have been a learner in that class, how would you have felt? Hopefully this movie will go better. Oh, no. Sandra, I am... You can't leave this up to a dorky academician to try and fix these things.
There you go. Yeah.
Which one?
Put it on there. Here we go.
Okay.
This left-handed, sorry.
Right.
Great architecture. Look at your passions. Even that will assure you a job. Louis Kahn died in a men's room in Penn Station. For days, no one claimed the body. Look at that. Is that beautiful? The money men did not weep because the great ones are impossible to deal with. They're a pain in the ass because they know that if they do their jobs properly, if they just this once get it right, they can actually live.
No! What is happening to my movies?
I don't know.
Okay.
Let me go back to see if I can get it started. I apologize.
That's not made up your problem. So again, I'm going to have to interpret this movie. Hopefully the other 2 movies will go okay. So he's in this architectural class, and basically what he does
Guy in the men's room in Penn Station, for days, no one claimed the body. Look at that. Is that beautiful? The money men.
It looks like it's
did
going to
not
stop.
eat
He does.
because the great ones are impossible to deal with.
Okay, don't worry about it.
Because they know.
So, all right, I'm going to interpret this again. I know this movie by heart too. So he holds up a brick and he says, "What is this?" And somebody yells out a brick. He says, "Yeah." Someone else yells a weapon, and everybody laughs. He says, he then throws up some slides on the pyramids, on the Louvre, all these beautiful places that have been created through bricks and stone and so forth. And what he ends up doing in this class is inspiring the students to go to the next level. Now, they're not going to build necessarily anything like that, but this is a very inspirational, the rest of the play, this is a very inspirational kind of first contact with students to make them feel like this course is really going to be something they're going to like, enjoy, and be part of. Mostly because of his enthusiasm, which is not always so easy. You know, when you wake up every day and you're doing some of the same things with students and residents, you have to remind yourself that this may be the 40th time or 80th time or 100th time for you, but it's the first time for that student, first time for that resident. So to build that learning climate is just extremely important. Again, I apologize about the slides. I don't know what happened, but it's probably on my shoulders. Okay. I hope the rest of them. I don't want to go back to school. Nobody likes me. They tease me and pull my hair and beat me up. I hate it. No one said teaching would be easy, dude. Yeah. Some more quotes. Everyone sees the world in a different way, and I'm trying to capture what I see and encourage others to look, to learn, to grow and understand, and build an affinity with the sky. Stephen Weir, astronaut. We teach to change the world. Stephen Brookfield, who's an adult learning guru. I just saw on that sheet weights last week. About Michael Carver, he's talking about another drummer. He's almost clairvoyant in the sense that he really gets inside the student and knows each particular person's needs. Billy Hart, jazz musician. It's not really about how many things you can do, it's about how many ways you can do one thing. So these are nice quotes, I think, about teaching in terms of, you know, the latitude we have in terms of being creative, thinking out of the box, making it fun. Somebody wrote on my session this morning, that it was a fun session. I'm thinking, wow, that to me is what learning, I mean, learning isn't always fun because it's around difficult patient problems that are sad, but when it can be, learning should be fun and not some sort of thing that we just have to do. So the excellent teacher, we're finally on the teacher. I think the excellent teacher promotes enjoyment of learning and facilitates useful learning. I think that's an important job of ours. If somebody said that I really was instrumental in challenging, stimulating, inspiring, promoting enjoyment of learning, they wouldn't have to say anything else about me. That's enough. I think they said it all. Because that's our job. Our job is not to give information to try and learn. It's to facilitate further investigation by the learner to get where they need to be. And we're there as a way to help promote them. Trust, again, I think is important in terms of how people learn. It gets back to learning climate. But in small groups, this is easier to do. In larger groups, in a lecture hall, it's a lot harder to do. But, you know, again, getting out from behind the podium, walking the room, you know, talking directly to students, residents, and so forth can really help that situation. Models humanism. So, I mean, part of what we're all about, and that's walking the walk. It's one thing to say it in the classroom. If we don't model it, the trainees are not going to pick up on it. The leadership issues. We don't teach some of these things very well, facilitating group discussions, like on rounds. Not many places have workshops that help residents with that, or even faculty, being mentors, coaches, and so forth. Searches for meaning in our work through scholarship. It's an important part of teaching, and providing timely feedback, which is corrective and reinforcing. A former head of the American College of Surgeons came to visit us one time, and I heard him say something about taking people to new heights, and I went up to him afterwards and I said, I'd love that. Can I use that? He says, oh, absolutely. I think, taking people to new heights is something that really is an important part of what I do. Most of the people that came through pediatrics didn't become pediatricians. Very few of them did. Maybe, 20% of them, or even less. But the fact is if you can stimulate and inspire people and take people to that next level where they never expected to go, you've done your job. You've done your job, even if they're going to be a surgeon or an internist or a family practitioner or whatever. Promoting self-directed learning, we already talked about that. In terms of the learner, that's critical, and that doesn't happen by talking down. It happens by stimulating them and making them be accessing knowledge and so forth. Of course, we have to be accessible, we have to be knowledgeable, and then there's that balance between showmanship and content expertise. Okay, I hope this film plays. So, in Dead Poets, we're going to figure out what was the message to the learner, and the implications of the message, and how would you describe the teacher's style?
Gentlemen, open your text, page 21 of the introduction. Mr. Perry, will you read the opening paragraph of the preface entitled Understanding Poetry?
Understanding Poetry by Dr. J. Evans Pritchard, Ph.D. To fully understand poetry, we must first be fluent with its meter, rhyme, and figures of speech, then ask two questions. One, how artfully has the objective of the poem been rendered? And two, how important is that objective? Question 1 rates the poem's perfection. Question 2 rates its importance. And once these questions have been answered, determining the poem's greatness becomes a relatively simple matter. If the poem's score for perfection is plotted on the horizontal of a graph, and its importance is plotted on the vertical, then calculating the total area of the poem yields the measure of its greatness. A sonnet by Byron might score high on the vertical, but only average on the horizontal. A Shakespearean sonnet, on the other hand, would score high both horizontally and vertically, yielding a massive total area, thereby revealing the poem to be truly great. As you proceed through the poetry in this book, practice this rating method. As your ability to evaluate poems in this manner grows, so will your enjoyment and understanding of poetry.
Excellent. That's what I think of Mr. J. Evans Pritchard. I'm not playing the pipe. We're talking about poetry. I like Byron. I give him a 42, but I can't dance to it. Now I want you to rip out that page. Rip out the entire page. Here, man. Rip it out. Rip it out! Come on, rip it out! Thank you, Mr. Dalton. Gentlemen, tell you what, don't just tear out that page, tear out the entire introduction. I want it gone. History. Leave nothing of it. Rip it out, rip! Be gone, J. Evans Pritchard, Ph.D. Rip! Spread his hair! Rip it out! I want there nothing but ripping of Mr. Pritchard! Put it on a roll! Not the Bible, you're not going to go to hell for this.
That's a good place to start. What do you think? I love that man. I wish I could have told him when he was alive. These guys aren't always easy to get a hold of, but I like to tell some of them how we use movies that they've been in because they probably never even knew that the movies were used like that. Every time you see a movie, look for some teaching points, learning points. What do you think? What's the message?
So he was able to engage the students by shocking them and making them realize that everything that's in a book isn't the gospel. not, just because it's written doesn't mean it's perfect.
Okay, so the comment there is that he engaged the students. He had them, he had their attention by shocking them. And basically what he was saying is everything in the book is not the way it always is. So what is that message? What's the bottom line then? In this class? Please.
He got them to step outside of what they normally do and actively engage in something they would not normally expect to do, like tearing up a book.
Good, so well, that message wasn't that clear. How did he get them to think about actively engaging in this course?
Was ripping out the pages of they're used to reading books and like a textbook you don't even mark up, and he got them to rip the pages out of the textbook.
So how are they going to interpret the poetry?
You can do it on their own, and they know
There
that
you
they're
go.
stepping out of
That's where I was looking
their
for.
environment.
So the message there was, you're going to read the poem. You're going to come to class prepared. And your opinion of that poem is going to be important, and then we're going to discuss that. So this is going to be a group enterprise. Now, I'm not lecturing to you about these poems, and Jay Evans Pritchard, whatever his name is not going to tell you what's a good poem and what's not a good poem. This is going to be discussing in class, meaning you come prepared. So any of you who do TDL, those students better be prepared. Or flipped classroom, the students or residents need to be prepared. They need to, if you've given them something to read on the outside, it needs to be read on the outside. There's a purpose to that. So that they come as engaged learners, and you can take them to greater heights because they've already mastered the little bit of knowledge you've given them. Now you can take them to further things up on the cognitive scale, taxonomy scale, Bloom's taxonomy, like synthesis, analysis, not knowledge, and not comprehension, but way beyond that. Make sense? So challenges, how do we make our teaching more learner-centered? How would we facilitate learning, giving up control? What kind of questions do we ask that stimulate learners to think at higher levels? How do we build reflection in our teaching? Those are things that I just listened. You probably could think of a lot more. Okay, just real quickly, so the curriculum today is a lot different than when I was around. We always were taught about objectives. Now we're talking about competencies, even at the student level, and milestones and entrustable professional activities. We kind of need to know what they are. We know that there are 6 basic competencies that the residency ACGME has outlined. Those have also, again, trickled down to the student level. I don't know how much are being used here, but they are being used around the country as corollaries to what's happening with residents. We need people to have time to apply what they're learning. So it's not enough just to present them with information. They have to have time. So if they're learning communication skills, and I know that happens here, they have to be talking to a standardized patient around a breast biopsy that was positive, and the student has to walk in the room, is given the information, and has to tell that woman, I'm sorry to tell you, but your biopsy came back positive. And usually that standardized patient will start to cry, and if the student is doing his or her job, will take the box of Kleenex and offer it to the woman, and maybe even put a hand on, and as a comforting thing, and that's all videotaped, and then the student's given feedback on that in terms of what he or she did well and what can be improved. That's opportunities to apply objectives in the curriculum. It's just not enough to know stuff. We have to judge people by performance. I don't care what they know. If they perform well, I know they know stuff. If they don't perform well, then I'm not sure what they know. The evaluation has to be linked, obviously. Balance between learner versus teacher-centered activities. Considering the level of the learner. So if we're talking about giving bad news, what should a second-year medical student be able to know about giving bad news versus a first-year resident? They're different, very different in terms of their development and what they know and so forth. And then providing opportunities to link contextual content in the field to other courses. So we'll do this one more film, hopefully this is okay. So I'll show you a clip from Mighty Ducks, and I just want you to watch in terms of what was the curricular objective here, how did the teacher teach it, how do you know the learners got it, and how does it apply to how we teach residents. So time out. I'm talking to my chief here. I'll just ask you. after all that preparation.
Standing. Go. Side to side. Shift your weight. Get comfortable on your ankles. Good. Keep your balance, Tom. Trust your ankles. That's okay, Charlie.
Soft hands. You don't shoot the puck to your teammate. You sail it to him.
No!
I was praying for that one to work too.
Oh my gosh.
God doesn't speak digital.
I am so tired of explaining movies this morning. Oh, I apologize.
Your acting skills are being called to question.
Okay, so in this movie, God in heaven, how can you stand this? In this movie, he really wants to teach the kids how to cradle a puck, a hockey puck. So he uses an egg. So of course, when the kids first start out, the eggs are splattering all over. So the curricular objective is how do you cradle a hockey puck? And instead of using a puck, which is very hard, would be hard to know whether they get it or don't get it, he innovatively, thinking out of the box, uses an egg. And it's messy when it starts. But what happens is the kids start to get it. And when they start to get it, you see his encouragement. Great job! You didn't break the egg, and when you send it to one of your teammates, you didn't. And that's what the movie really focuses on. So in this curricular objective, you see something, how do I really teach this well? How do I know they get it? And of course, the next step would be going to a puck. But at least in this simulation with an egg, you can see that they carefully cradle the egg so it doesn't break. Okay. So I'm going to back up now and look at the question we posed at the beginning. How do I know I'm teaching effectively? But we really look at this critically. We're talking about 4 areas that we need to pay attention to. Anyone we omit, there's going to be a gap in how effective we are at teaching. So it's going to involve, when I first started out, I thought it was all about the teacher. When I went to that first workshop, I said, if they can only improve the way I teach. Well, that's not the way it worked out. The way it worked out is I learned all about learners and who they are and how I fit in with them and learning climate. So that's what we need to think about in terms of answering the question. We need to think about the teacher in terms of our role. We need to think about who our learners are. We need to think about what learning climate are we operating in and how do these curricular objectives or competencies or milestones get implemented so that we know that our trainees get it and have it. And the best way to do that, of course, is with our observation. So what we had planned initially, and there's only 20 minutes left because I blabbed so much, we were going to break you out into groups in teacher, learner, learning environment, and curriculum. But instead of doing that, I'm going to just field questions and ask or challenge you to come up with some concrete suggestions on how we may improve any one of those 4 areas. That's really something you would be doing at a table kind of thinking about it, but if you have any thoughts or suggestions about that, just yell them out. But I'll take questions in general about the actual presentation, minus 2 movies that didn't play through. About 3 movies. 2? 3. Yeah, 3. I'll never get invited back. Okay. Yeah, please. And stand, and I got a microphone, good. Just so everybody can hear you.
Excellent. This one's advice. So Miyagi, he got him to commit. So he said, if you want to learn more, come to the door. I mean, quite symbolic, but what are some of your recommendations on how to get somebody to bite kind of before you begin the teaching process? Get everybody committed and game.
Everybody hear the question? All right, repeat the question again because some people up here couldn't hear it.
How do you hook somebody? How do you
hook somebody? Okay, so as a teacher, I'm going to role model something for you that you need to do a lot more of in terms of what I've seen at my own institution, and that is don't answer the question. You can handle it 2 ways. You could say to the learner, first-year medical student out there, that really is an interesting question. Obviously, you've been thinking about that. How would you best answer that? That's one way. If you're in a group, because I already have been, obviously. If you're in a group, you can say, so, what does a group think about that? Anybody have any ideas? Honest to God, when you do that, when things come out, they're so creative, when you allow them to be, versus you shutting off all, conversation by you saying, well, the way I would do that would be, who cares what you would do? I mean, yeah, we do care, because you have the ultimate responsibility and knowledge of making this go forward, but it's more important for them to commit themselves. So in a group, you could have, great question, who's got an answer to that? You're not copping out. You're going from a sage on the stage to a scribe on the side. Whatever that means. So anybody want to answer that? What's the hook? How do you get people hooked? Very broad question. So what were you thinking specifically with the hook issue?
Well, if somebody's into it, then they're already going to provide, they're going to, you said nibbling, so they're already going to be giving you, their initiative, and then you can feed that flame. But if you have somebody that's in a team that has been disengaged, and you'd said maybe something personally is an issue, but how do you, if you have a week with this person, and you still want that student for my role, or in some way to glean some information, try to do this efficiently so that it's happening day one. I was just hoping for a tip or two.
Yeah, so at the student level, how do students choose their careers if they really are being mentored appropriately? Okay, so it's going to be content, right? They're going to be interested in content to start out with. Keep going.
They need it to be in context. They need something to framework around.
Okay.
They see the value of the material.
The value of the material, how I could best fit in with this. That's another issue.
Inspirational mentors.
There you go. Now we're getting someplace. So who are the people in this profession? Are these people I want to spend time with? Are these people I relate to? That changes people's career choices immediately sometimes. I had a woman who was going into surgery because of one surgeon at our school who really walked on water. He was the most unbelievable guy. He became the head of surgery at Georgetown. Left GW, went to Georgetown. And Steve Evans was an unbelievable guy. She came to me in August of her senior year and she said, I changed my mind. I said, what do you mean? She said, well, I found out that no one's like Steve Evans. And I guess I was just going by my one contact with him. And so she ended up switching into pediatrics. I made very sure that's where she belonged, with a lot of questions and so forth, but it's the people you work with and the environment in which you work. So it's content, people, environment. So to answer your question, as they look at those things, one of the most important things, which is pretty subtle, is how you role model, and how much enthusiasm you show, and how much humanism you have. And someone says to themselves, well, I don't know if I can be like him, but I like what he stands for, or what she stands for. So I don't know if that answers the question, but that certainly is one hook. And of course the other hooks are, just raising people's creativity levels and doing fun things. And, so when they leave the rotation, they can say, that was a good rotation. That was fun. I really learned that. Even though I'm not going into that field, I'll remember that. And those are the things I think that get people hooked, like anything else. Please.
One thing, consider myself a beginning level teacher, but one thing that I've found that works is if I can learn enough about a student or resident to know where they're going or what they're interested in, and then make whatever we're doing practical to that and try to put them in a practical scenario. Like, you're going to see this someday, this kid's going to walk into your office, or this, that will make them realize, it almost shocks them into reality. I'm going to see this someday, I got to learn this. Whatever it is.
Great. Another good example. Who else? Answer that question.
I think to follow up on what you said, it's clear roles and responsibilities as well. There's a disconnect there. so it's clear roles and responsibilities. The student has to know what you're expecting them to do, and you have to be clear that of what you are and what you aren't going to do. And I think if those boundaries are set up, they're more likely to be engaged.
Also making the student or the resident to see in whatever they are interested, how this work is relevant.
For example, I'm a psychiatrist and podiatrists rotate in consultation. So what's the link between the foot and the brain or the mind? So I make them see how this mental illnesses, when they're treating, they're still the primary and how it is relevant for them to know about it. So I'm approaching from their side of perspective as a pediatrist, why this is relevant. So their interest becomes more in knowing about the aspect. That's how you can hook them up.
Anybody else? That was a good question. Any other questions about, in general, what we talked about? Any people that have anything to say about countering some of the things I presented, or reaffirming some of those things, or based on your own knowledge and practice and so forth? There's a wealth of practice in this room. In terms of your experiences with trainees. Please.
What do you think the value of collegiality with students is? In other words, they're aspiring to be part of a profession.
So it's a broad term, and I'm thinking about this because, I think there are a lot of aspects to this. It's a question of, the collegiality of students. So give me just an example of what you might be thinking.
It's very difficult for a first or second year medical student to see themselves as part of the profession. But I think sometimes calling them a colleague in the profession, talking about their life when they're residents and young physicians, what that might be like, and how you as an old guy might even be seeing them as a provider. So the idea of welcoming them into the profession.
So I don't know that I can answer your question, but I'll just give you one example in terms of boundaries. So I have now that I'm emeritus, whoopee, you get free parking. After 43 years. So I have a group of, as a volunteer, we have a course called Professional Development. It's really professional identity. Really cool course. It's what happens to a student on the way to becoming a physician. It used to be, when you get to this stage of life, you'll find out what it's like. Well, we're trying to teach you that. And the session that's going to be held on Thursday, that I'm going to leave you with my group of students, I'm getting into your question, is boundaries. Boundaries between doctors and patients, boundaries between teachers and students, teachers and trainees. And I'm not sure what the answer to that is, but I'll tell you how it started out. So our first day, went around the room, we introduced each other, told a little bit about ourselves, so we got a chance to really know each other. There's 8 students and 2 facilitators. My co-facilitator is a social worker in private practice in the community. She's a volunteer, and I. So it came to the point where, okay, what do you want to be called? I want to be called by my first name, the students. I said, what do you want to call me? I said, well, we're going to call you Dr. Greenberg. And I said, oh, because of my age? And, this is not very clear. But what was decided on, not because I said anything, well, how about Dr. G? So that's perfect. If that's what you want to call me Dr. G. The question of, where the boundaries are and how close do you get, and I'm still conflicted on that. When I've been ward medical attending in the past, I've taken the residents and students out to lunch every time I've been a ward medical attending. Is that breaking boundaries? I don't see it that way. I see it as an act of whatever, humanism, whatever you want to call it, collegial, thanking them for their time on service and the work that they did. And Some people may look at that as, you know, you're giving the students a grade, you're evaluating the residents. I mean, where are the boundaries there? That's a really hard question, I think. Anybody comment on that?
I don't know, sometimes it's easier to go back to the things that we all share as attendings and students, the kinds of emotions we might feel when we approach a patient. And so when you're making rounds or doing things with patients, you know, it's okay to say, that makes me sad. How does that make you feel? Or this was really hard for me to talk to that family. I'm not sure that I did it right. What do you think you would do? I mean, because that's a commonality that we all share. We're all adults. We're all human beings. We all share these things, and focusing on that, I don't know, maybe that's coming at the question from a different direction, but using the commonalities that we have to establish a common ground, then yeah, I think there are boundaries. There are things you probably can't do. They're usually more institutional type restrictions as opposed to what we share.
I liked your answer. I liked your answer. I thought that was a good answer. In terms of bringing, you know, groups closer together. It's not a fraternity or sorority, you know, it's not hazing. I mean, they are apprentices. Residents and students are apprentices. That's why they're going through training, just like we did. But yeah, we don't have to treat them in a way that's not respectful and, you know, it can be cool.
I like to think of the students as almost junior officers in a ship.
Okay.
Okay. Yeah, there are a lot of boundaries, but
It's being recorded.
It's recorded, yeah, it's recorded.
I said I'd like to think of the students as junior officers in a ship. On a ship, there are many, many boundaries. I mean, the CO doesn't go drinking with the students, but the CO does have events where the officers all get together. And the students, like JOs, have an awful lot to learn. But they're part of that officer community in the ship.
Yeah, they're going to be in our shoes in a few years. Yeah.
Dr. Greenberg. I think a great place, to Dr. Gilbert's point, to initiate this is during orientation, like you spoke of a little bit earlier. Dr. Jim Sherman, pediatrics, recently retired. You could have observed his orientations at any time. He would have these outstanding orientations, really simple, laid back. You sit together as a group. So where'd you go to med school? What'd you do when you were a kid? Just familiarizing yourself with one another. Hey, I went to Ohio State. I did this. You know, just making those connections early on, and those continue out throughout the rest of the rotation. And he really saw a lot of value in it. And just observing his orientations was something really to get excited about.
Yeah, and I said you got one crack at that. So it's something that has to be planned, and you know, you gotta engage people that first time around. When I was clerkship director in pediatrics, I told the students if they didn't think this was the best educational experience in medical school, at the end of their 8 weeks, I wanted to know why. And I knew damn well it wasn't. Not because of me. It was my faculty. So I occasionally got people that disagree with that. But that's how you hook them in, and how that first impression is, you know, going to be made in terms of, is this going to be a good experience for me, or is this not? Yeah. We're about out of time, unless there is one more question. We take one more. Otherwise, I want to thank all of you because you gave your valuable time, and thank you again for really honoring me by inviting me to your educational day. And I know there are a few more activities left. Hopefully some of you will come this evening. And again, appreciate your attention today. I was going to tell you to lock the room because there's only enough room for 109 people, but we were.